Thank you, Mr. Chairman. Madam Secretary, the cost of human services, it continues to climb. You've spoke about it here today. It's been, over the past few years, $1 billion a year. This time, the new cost to taxpayers is proposed to be more than $2 billion. So I was heartened with all of those savings that you have mentioned here today. And want to know, are you committing to only $300 million in growth a year as presented in this budget for the out years?
Well, you know, one of the challenges that we face when we plan our out-year budgets is something that I know you all are very well aware of, but I just want to say it out loud for folks that don't live in the weeds of appropriations, which is that, as I mentioned earlier, we negotiate our Medicaid MCO contracts on a calendar year. And so the budget, of course, is not on a calendar year.
Right.
And so
and you
we
shared that earlier.
And we saw it this year, where while we had a placeholder number for January of 2025 to June of 2025 in our budget, when the rates were when the actuary completed the rate analysis and determined the actuarially sound rates, and we went into negotiations, which were very contentious. I know some of you got phone calls about them, because we try to keep those rates as low as we can. We were above what had been budgeted in this year. And so I think and this is why I shared with you this capitation rate setting diagram. There are so many factors that go into the rates that none of us can predict. What I can say to you is, historically,
you will do everything you possibly can in any future negotiations to try and hold that growth to what you have projected in this year's budget. Again, you've got the largest, most expensive part of our state budget, so it would be greatly appreciated.
I didn't get a chance to copy this for all of you, but historically, we have done extremely well. This top line is U.S. Medicaid growth, and down
we would
here
appreciate you sharing that with the committee.
So
if I could,
we're working hard.
I have very little time, but I wanted to follow up on the questions with regard to SNAP work requirements. With the you had a conversation with the gentlelady from Montgomery County, and am I to understand that when the federal waiver for able-bodied recipients of food stamps to not have work requirements that have been in place for the last 8 years, that exemption for the estimated 170,000 able-bodied Pennsylvanians will no longer be in existence? Is that correct?
It's a little bit lower than that right now, I think. I think also what's important to know is that we think about 40% of those folks. I think right now it's about 147,000 approximately, 150. It's in that ballpark. We also think that about 40% of those folks are actually working but not earning enough wages that they are out of eligibility for SNAP.
But your department is not going to apply for the SNAP work requirement waiver again?
We don't anticipate applying for it statewide. We're not going to meet the requirements. I don't have an answer for you just yet on whether there may be regions in the state where we will apply. And it's really important, and I just want to share with you why we would do that.
Exactly how those regional waivers are applied for, because right now there's a waiver for 7 counties: Adams, Center, Chester, Lancaster, Lebanon, Montgomery, and York. They were granted discretionary exemptions from the work requirement, meaning that they don't have to demonstrate economic hardship to be exempt from those work requirements. I'm curious because those discretionary waivers for counties like York, with unemployment in this past year of 3%, if you look at the York-Adams or the York-Hanover greater area, our unemployment is 2.5%. Our businesses are clamoring for people to fill jobs. So can you explain exactly how those counties were selected?
I can get you the list of federal requirements. We can follow up with you. I don't have that right in front of me. But I really do want to mention that it's not just about there are wider impacts when people lose their SNAP. The University of Pittsburgh has recently shared with us data that when a healthy person is disenrolled from SNAP, often because of work requirements, we see a $56 increase in per member per month medical spending in our Medicaid program. For someone with a pre-existing chronic condition, we see an increase of $123 per member per month. And for somebody with diabetes, we see a $270 per member per month increase when someone loses their SNAP. So I do want to just make sure that you're thinking about the whole impact here when people lose SNAP.
Well, I certainly think we most definitely are thinking about the whole impact, and it's a very large entitlement program, and we're trying to make sure that in the challenging financial circumstances that we face in this Commonwealth, that we have the resources to care for the neediest and most vulnerable
this is the beauty of
among
SNAP.
us. So
It's
I very much
entirely
appreciate
federal
your answer here
dollars.
today,
SNAP
Madam
is
Secretary.
entirely federal
Thank you,
dollars.
Mr. Chairman.